Welcome to this webinar on advancing healthy out-of-school time and an introduction to the National After-School Association, NAA, standards for healthy eating and physical activity. This webinar is hosted by the Healthy Out-of-School Time Coalition. I'm Georgia Hall, Senior Research Scientist at the National Institute on Out-of-School Time. By the end of this session, we hope you'll log off feeling like you understand the NAA Healthy Eating and Physical Activity Standards and why they're important to our nation's children. We hope the information we share will prepare and inspire you to talk to your colleagues about creating a standards implementation plan that's right for your program. A national movement is underway among OST providers, intermediaries, and advocates to promote healthy eating and physical activity in before-school, after-school, and vacation programs and camps. Families and school communities are looking to OST programs to help keep children and youth eating well and physically active. The Healthy Out-of-School Time, or HOST, Coalition is a growing partnership of leaders in the OST field working to foster health and well-being practices in OST programs nationwide. One of the key milestones of the HOST Coalition includes developing consensus on rigorous standards for healthy eating and physical activity in OST programs. In this webinar, we will introduce the NAA standards for healthy eating and physical activity developed by HOST and adopted by NAA in 2011. Physical inactivity and unhealthy eating pose a serious threat to our nation's children, healthcare system, and economy. 1/3 of U.S. children and adolescents are at increased risk of heart disease, type 2 diabetes, and other health problems. Obesity is now the most prevalent nutritional disease of children and adolescents. Why are OST programs such a vital setting for addressing the crisis of childhood obesity? Programs serve over 8 million children per year in this country. Children may be in programs for 15 hours or more per week. A growing number of intervention studies provide evidence that intentional efforts during out-of-school time can improve the eating environment and increase physical activity opportunities for youth. This makes the out-of-school time setting a key component to helping combat childhood obesity. We are all gatekeepers for children's healthy development. The NAA standards for healthy eating and physical activity were developed in 2010 by members of the HOST Coalition with funding provided by the Robert Wood Johnson Foundation Healthy Eating and Active Living Research Programs and then adopted by NAA in 2011. Since being adopted by NAA, the standards have been disseminated to thousands of out-of-school time program providers, professionals, and supporters. Continued promotion, adoption, implementation, and evaluation are underway. It is hoped that implementation of these evidence-based practical standards in your program will foster the best possible nutrition and physical activity outcomes for children in grades K-12 attending OST programs. Let's hear one OST program provider's story about implementing the Healthy Eating and Physical Activity, or HEPA, standards.
I'm Kimberly Meyer. I work for the Southern District YMCA, serving the greater Exeter, New Hampshire area. For the last 3 years, we have made a commitment to implement the healthy eating and physical activity standards in our 16 school-age childcare programs. While we continue to evolve, implementation has helped keep our programs and children stay on a path to wellness. Implementation of the standards is not only a commitment to our healthy living mission, but it is also good for business. Being a HEPA standards committed YMCA is a market differentiator. School-age childcare stakeholders, including parents and school partners, are grateful that we have adopted evidence-based strategies to keep children healthy and happy. Adopting the standards has made good programs great. We have been able to recognize our programs and celebrate staff for the great health-conscious practices already in place, and then to push ourselves to be even better. Because of the wonderful work staff does every day, we are able to take on the challenge of implementing the standards to be the best we can be. Committing to HEPA means we allow the standards to permeate all of our work at the YMCA, from staff meetings to sponsorship decisions to the snacks we serve our program participants.
In late 2012, Robert Wood Johnson Foundation and the American Heart Association announced a collaboration to reverse the nation's childhood obesity epidemic by 2015. This advocacy initiative, Voices for Healthy Kids, focuses on changing local, state, and federal policies to help children and adolescents eat healthier foods and be more active. Under the new initiative, there is a focus on policy interventions to advance 6 priorities that research shows are likely to have the greatest impact on childhood obesity. The YMCA of the USA received funding from Robert Wood Johnson Foundation to serve as the advocacy hub lead to help improve physical activity standards for out-of-school and out-of-class time in underserved communities. Voices for Healthy Kids, Active Kids Out of School, works to engage with other national OST providers to commit to the NAA HEPA standards and to assist providers in developing implementation plans to integrate the best practices into the design and delivery of all OST programming. YUSA is sharing the mechanisms they have used to reach underserved communities and the strategies they have taken to implement the best practices in communities facing the greatest needs. The resources that have contributed to the YUSA's success, such as measurement tools, formal trainings, curricula, and quality assessments, are being shared with other OST providers in an effort to disseminate strategies and best practices. Together with the host coalition, the YUSA is working to transform the OST time environment to become active leaders advocating for children through the HEPA standards. Let's first talk about and explore information about healthy eating. What are the impacts of poor nutrition, inactivity, and weight problems? The answer is hypertension, anemia, osteoporosis, dental disease, and obesity. On the other hand, good nutrition and activity is linked to optimal cognitive functioning, stronger academic performance, higher standardized achievement tests, better daily attendance for school, and class participation. By creating healthy environments, standards can influence the behavior of staff and children in OST, an idea supported by research showing that the availability of healthy food, peers, and adult role models influence children's eating habits. Now let's talk and explore information about physical activity. Physical activity among adolescents is consistently related to higher levels of self-esteem and lower levels of anxiety and stress. Studies have linked physical activity to stronger academic achievement, increased concentration, improved math, reading, and writing test scores, better attendance, positive attitude toward school, and a profound reduction in chronic disease risks. The U.S. Department of Health and Human Services and the National Association for Sport and Physical Education recommend that children engage in at least 60 minutes of moderate to vigorous physical activity each day. Less than 2/3 of youth in a national survey report that they actually participate in vigorous exercise 3 or more times a week. The OST hours can make a significant contribution toward the 60 minutes a day of moderate to vigorous activity recommended. Take a quick moment to reflect on your program. If you are viewing with others, you may want to pause this webinar and think together about all the aspects of your program and in what ways your program promotes healthy eating and physical activity. Let me explain the HEPA standards. For both healthy eating and physical activity, the first standard is about content and quality. The Content and Quality Standard for Healthy Eating recommends that programs serve foods and beverages in amounts and types that promote lifelong health and help prevent chronic disease. These include minimally processed foods made with whole grains and heart-healthy fats or oils and without added sugar or trans fats. fruits and vegetables, and beverages made without added sugars. The Content and Quality Standard for Physical Activity recommends the program's physical activity offerings support the U.S. Department of Health and Human Services guidelines recommending that all children and youth obtain at least 60 minutes of physical activity per day. That includes a mixture of moderate and vigorous intensity activity as well as bone and muscle strengthening activities. We know from lots of experience on the ground and research that making these changes requires lots of infrastructure support and change in approach. The other standards are about best practice. Based on experience and science, we believe that these practices will help programs fully embrace a new approach to youth wellness. These best practice standards for healthy eating are staff training, nutrition education and curriculum, social support, program support, and environmental support. These best practice standards for physical activity are staff training, social support, program support, and environmental support. We invite and encourage you to explore together these best practice standards on the NAA Standards document. A vision for a healthier country cannot be complete without the involvement of OST programs. After-school programs can help over 8 million children meet their healthy eating and physical activity needs and start them on a healthy habit for life. Achieving these standards requires more than an executive decision. While many of the standards are easily adopted and cost little or nothing, some of the standards are harder than others to put into place, and many will require planning, retraining, and even rebudgeting. Programs should set themselves on a path to accomplish them over time. There are program providers already working hard on reaching the new HEPA standards in their programs. Resources and materials are available to support your efforts. Program staff are the key facilitators and motivators of youth participation in program activities. Enhancing staff skills in delivering healthy eating and physical activities and expanding staff knowledge about the importance of healthy eating and physical activity will position staff to be valuable change agents in affecting youth behaviors. For now, give your team a yes if you know why the standards for healthy eating and physical activity in out-of-school time are important, you understand you are starting out on a process towards achieving the standards, and now that you understand the issue and process, you are ready to commit to the work. Think about these questions together. What are the implications of the new standards for your program? What are potential strategies and approaches for aligning practice to the standards? What challenges will be associated with implementation of the new standards? What does it mean for staff training, cost, schedule? While you work on implementing the standards, recognize sites or staff for making positive changes. Share your experiences with successful implementation of a standard. Be patient, persistent, and stay focused. We all benefit from healthy eating and more physical activity in OST programs. Thank you for being a part of advancing healthy out-of-school time. Here is a link to resources to help you on your way.